Welcome back to Daytime Ottawa. It is Mental Health Week, and we're going to be talking about it, by the way, all week long, with a lot of our focus on youth mental health. And here to speak on exactly that, I am joined by Dr. Gail Beck. She is the interim psychiatrist in chief and chief of staff over at the Royal. Welcome. Great to have you here, Dr. Beck. Dr. Beck, let's just talk about youth mental health in general. I'll get to the pandemic and the impact it's had, but Are you seeing more and more young people sort of struggling with their mental health over the last, say, decade?
We are in general, certainly even over the last 20 years. I think that the awareness of mental health and youth mental health and mental health in general has just increased. Stigma's been reduced, and so more and more families and parents and youth themselves are coming forward when they're struggling, and we want that.
And I was going to say, what I find really interesting is you can almost get two polar opposites sometimes with youth, and some that perhaps don't want to talk about it. But I have seen more and more youth becoming much more comfortable talking about mental health and having conversations with their peers. Is that your experience as well?
That is my experience. We're seeing that and we're hearing about that in schools. So one of the programs that I work with directly is in a high school.
Okay.
And so we've got 2 classrooms there. But in addition, what we're hearing from the people in the high school itself is that they're hearing more conversations around mental health. I think the other thing that's important is actually that all the school boards in Ottawa and probably across the country have really taken the time to open up questions about mental health.
Right. Let's talk about the pandemic. I told you we'd get to it. What kind of impact have we seen on youth mental health?
I think it depends on where you look at the spectrum. If you think of young people and adolescents, we know that it's had an impact. Especially at the beginning, people were very worried about where their lives were going. All of a sudden, so think about people in grade 12 in March 2020. They had their acceptance to university, but no idea what that was going to look like any longer. And in March, some of them weren't even sure they were actually going to be able to finish because online learning was so different from learning in a classroom. I remember I had one person say to me that they never thought they'd ever say that they actually wanted to be back in school.
Yeah.
But people were saying that. I think the same was true in that university and college sector, that they were also worried about they'd spent all this money and where were they going to end up.
Of course.
The other thing we know is that for very young children who are developing, that when people were wearing masks all the time, some of the visual cues that they have when they're learning to speak, learning to listen, they'd lost those, and so we know that they're seeing an impact in that regard. On the other hand, there have been some studies that suggest that maybe the impact wasn't as great as we thought. It's hard to know. It was one study that was a review. Is that out of
Montreal? That study
it was out of Montreal, and I'm not sure it wasn't just youth, but it did a lot of review studies.
They studied like over 200 other studies, was my understanding.
That's right.
Yeah.
So. It's very compelling to look at that and think, really? Because that's really at odds with our clinical experience in the hospital itself, where we do see the number of referrals increased, and we do see the seriousness of the problems having gotten worse as well.
What are some of the other stressors and challenges when it comes to youth mental health?
I think probably the biggest stressor, and not, again, just in youth mental health, but is access. So we know that the number of psychiatrists, the number of mental health, allied health staff is really not what it needs to be to manage the difficulties that we're seeing. And yet at the same time, the other impact, I think, is that as well in this city, the number of family doctors is decreasing. So there are 150,000 people from Ottawa who don't have access to a family doctor, and family physicians are the front line of mental health.
Yeah, and is that a matter of, I know it's funding is part of that. Are we seeing enough people getting into psychology and psychiatry?
So
is that a challenge as well?
We know that we're not in psychiatry at this time of year. This is the time of year when medical students choose their specialty. And we know that 2 specialties that are not getting all of the applicants they need to are family medicine and psychiatry. So I don't know if that's only a matter of mental health or of,
Right.
you know, the funding, because mental health is not a well-paid specialty.
No.
But I think it's also people are realizing this is not an easy specialty.
Yeah.
Right? This has its own stressors. And even at this time, we know that medical students and physicians themselves are feeling stressed out. And our staff, right? We
Yeah,
know
of course.
it's been stressful work to work through the pandemic.
Dr. Beck, what are some of the signs we should look for in you know, not just youth, but in a friend or family member?
I think the biggest change that people notice is when somebody is just not themselves. And you know, you'll ask them what's going on, and you can see that their responsiveness is not what you're used to, and they may not even quite realize it themselves. I find that parents are the first people to know when
Right.
they're right, and yet if you don't completely know what it is, the other thing we know is that kids don't want to worry their parents.
Yeah.
So maybe they're anxious about their exams, maybe they're just feeling sad. You know, sadness and anxiety, everybody experiences them from time to time. Everybody thinks they'll get over them, and so they may not mention them.
Right.
But I think that a parent really has to sort of say, you know, you're just not yourself, you're off. And what's going on, and spend extra time with that person just to be with them and to see if eventually what is happening really emerges.
Yeah, and I mean that's how to approach, and then of course I guess you try to gauge from that point whether you need to seek professional help or even suggest it to the person.
Well, I think that I always say to people, suggest and do what you need to do. Go to your family doctor, reach out and see and do your best to find the help. Because the other thing we know, unfortunately, with long wait lists is that if you hesitate, the wait list gets even longer.
Right, right.
And so you're better to reach out and have it not be something that needs attention,
Yeah.
rather than not reach out and be waiting at a critical
Great advice,
time.
Dr. Beck. Thanks so much. We'll be right back after this.